Referrals for mental health counseling are rising. Referrals for LGBTQ plus people seeking counseling are rising even faster. The Trevor Project, a nonprofit focused on the mental health crisis for LGBTQ plus people, has found that approximately 56% of LGBTQ plus youth reported wanting counseling this last year and not being able to access it. I am a therapist and a queer woman, and I have been working at the intersection of LGBTQ plus advocacy and mental health for the better part of 5 years. When I think about the privilege of getting to sit with so many children, adolescents, adults, and families, all at various points along their journey, I am amazed at the strength, resiliency, and hope of so many members of my community. We know that the United States mental health care system is struggling to meet a growing demand. According to the National Alliance on Mental Illness, lesbian, gay, and bisexual adults are 2 times more likely to experience a mental health condition than their heterosexual counterparts. Trans people, 4 times more likely. According to the Trevor Project's 2023 work around mental health outcomes for LGBTQ plus youth, fewer than 40% of queer youth in our country find their homes to be a supportive space for their identity. Many of these youth report thoughts of suicide when facing rejection from family, from friends, from community members. Within this, LGBTQ plus BIPOC youth consistently disclosed higher suicide attempts than their white peers, particularly Native and Indigenous youth, as well as Black, trans, and non-binary youth. Allies matter now more than ever. You may be sitting there thinking to yourself, but Julia, maybe these youth are feeling depressed because of their identity. It's a question I've heard many times before, and we know that the data points to a breakdown in community support for the individual. When I reflect on the common denominator among all the different individuals I have had the privilege of serving, I am astounded at the difference one safe person makes in the life of someone's journey to come out. While many of us would have ideally had a whole network of people to support and connect us, the research indicates that what I see month to month, anecdotally in the therapy room, is true. The power of allyship makes all the difference. The first person I came out to was a clinical psychologist. They responded the best they could, but led with fear, anxiety, and their own emotions. The second time, I came out to 2 individuals who are now also both clinical psychologists. They led with empathy, compassion, and listening to hear my emotions. Their allyship has maintained, and their allyship has blossomed into becoming 2 of my closest friends. Social support, or informal support outside of our therapy offices, is more important than ever before. The Trevor Project has found that LGBTQ plus youth who experience positive support from within the home, these youth are 2 to 3 times less likely to experience thoughts of suicide and less likely to make a suicide attempt later on. When anyone comes into our counseling offices reporting thoughts of hopelessness, one of the many steps we take as counselors is ensuring these individuals are able to think of at least a couple of safe people that they're able to rely on when needing support. Now, you may be thinking to yourself, Julia, I love my gay friends. But how can I support them when it goes against my personal values, my cultural values, my religious values? To this I say, as someone who also identifies as a person of faith, I ask you to examine the difference in your mind between love and support. Many of us gathered here today love Ted, right? But can we love Ted without supporting Ted? Can we show pride in Ted without showing up for these amazing events? Without wanting to talk about Ted further when asked? As a therapist, my job is not to change anyone's mind or convince anyone of anything. My aim is to hold space, to reflect, to challenge when needed, and to grow alongside my clients and the systems they live and operate within. My aim is to provide both insight and information through the power of the therapeutic relationship to help each other see things just a little differently. I hope to do the same for you in the remainder of our time today. So I like to think about allyship in 4 main steps with the acronym ALLY. Step 1 is going to be to assess. When you enter into a conversation as an ally, the most important thing for you to do is to assess what's being asked of me. Is my role to validate, to support, to problem solve? Once you determine the lay of the land through assessment, you will then be able to respond most effectively. On to step 2. Step 2 is to listen. As someone who's been a part of the process, the before, the middle, the after, both personally and professionally, so many times already, I can't overstate the importance of listening. And not just listening to listen, to check a box, but listening to truly hear what your friend, what your family member, what your neighbor is saying, and what they may not be saying. Step 3 is to learn. Now, many of you gathered here today look pretty smart, and I'm sure that there's a lot that you know already. But what none of us know yet is what we will learn in the moment of connection with another human being. The magic of the therapeutic relationship is the magic of the human relationship. Learning from one another in our most vulnerable moments. And finally, step 4 is all of you. What information are you missing? What might be making you a little uncomfortable if you're really honest with yourself? What do you not know yet? Where might you need to seek out some support? When you assess, when you listen, when you learn, you are then poised to see where you fit in the puzzle of allyship. As I prepare to send you all out through these doors into your role as ally today, I encourage you to take with you the words of one of the world's greatest allies and my personal heroes, Fred Rogers, better known as Mr. Rogers. He says, all of us at some time or other need help. Whether giving or receiving help, each of us has something valuable to bring to the world. That's one of the things that connects us as neighbors. In our own way, each of us is a giver and a receiver. Thank you.